Okay, the name of this video is What Do Cardiac Patients Want? Okay, so once upon a time there was a lady who had some cardiac problems, and she was also in a wheelchair, and she had a nice young man who was helping to take care of her, pushed her in the wheelchair, and he brought her out to the beach, and it was a lovely day, and she was having such a good time. She said, "Can you push me up close to the water? I can maybe feel the water running over my toes as the tide comes in." And she says, "Oh, it's just such a lovely day, and I'm having such a nice time today. Could you maybe give me a little hug? Could you maybe give me a little kiss?" And reluctantly, the guy gives her a hug and he gives her a kiss. And then she says, "Well, could you maybe just give me one little F?" And then he tips the wheelchair over and he says, "Now you're effed." Okay, now that was a bit of a mean joke, but let me explain what I'm talking about. The cardiac patient goes to the doctor for cardiac problems. Okay, so what does he do? He puts her on a statin for high cholesterol. By the way, the cardiac is one of the most highly energetic parts of the entire human body. If you look at a PET scan for glucose uptake, you're going to have the most uptake in your brain, and then second to that is going to be your heart, especially the left ventricle. Okay, so he puts her on a statin for high cholesterol. He then puts her on a beta blocker for hypertension. You need 2 drugs for hypertension in this patient, so he puts her on a diuretic, hydrochlorothiazide, for her hypertension. Then she's got a little bit of diabetes, so he puts her on metformin for her diabetes. There's maybe a little hint of some AFib, so puts her on some Plavix, anticoagulant for her AFib. Okay, so now, do you get the joke yet? Do you get the joke yet? Okay, if you don't get the joke yet, let's take a look at the next slide. It'll explain it. So here's a chart of mitochondrial inhibitors. Like I told you, there was nothing in any of my old biochem books, but on my own, when I started going through all the papers on it, I quickly found 50, 60, 70 of them. Okay, so let's take a look at some of these mitochondrial inhibitors. First of all, we can see that the statins inhibit coenzyme Q, part of the inner mitochondrial membrane electron transport. By the way, about 90 to 95% of the ATP in your body is made in this mitochondria. So if your mitochondria doesn't work, you don't have much energy. You know that guy at MedCram, Roger Seaholt, pretty smart doctor, the pulmonologist, sleep study guy? He said, he has a good quote. He says, "If your mitochondria don't work, nothing works." Okay? All right, so anyways, the mitochondria are inhibited by the statins. Okay, well, that's one drug. Okay, maybe the trade-off is worth it. But let's take a look over here. Oh, metformin, the diabetes drug, that inhibits complex 1, which some people consider the most important complex. So it inhibits complex 1. That's inhibited too. And you know what? Hydrochlorothiazide also is a mitochondrial inhibitor. That diuretic's a mitochondrial inhibitor. And then it turns out the beta blockers are also a mitochondrial inhibitor. And so is Plavix. The Plavix is a mitochondrial inhibitor. So she went to the doctor because she's having problems. She's worried about her health. She doesn't have as much energy as she'd like to have. And he put her on 5 mitochondrial inhibitors. Okay? And then you'd say, well, that's not so good, but let's take a closer look. She's eaten, non-organic food. The soy is this basic protein in her processed food sprayed with glyphosate. That's a mitochondrial inhibitor. She has corn in her food, and that's the main thing for the sweetener, high fructose corn syrup. It's sprayed with atrazine, mitochondrial inhibitor, and it's often contaminated with mercury. That's a mitochondrial inhibitor. She has a little bit of fish every week because she heard fish is good for her. Just uses a little bit of oil to fry it on a nonstick cookware, which has POFA. Okay, mitochondrial inhibitor, mitochondrial inhibitor, mitochondrial inhibitor. She drinks to save money. She drinks tap water without filtering it. It's got estrogenics in it, some of which are mitochondrial inhibitors. It's got fluoride in it, mitochondrial inhibitor. It's got aluminum, mitochondrial inhibitor. So at a minimum, she's got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 mitochondrial inhibitors. So what I'm saying is, the old joke was, Lorraine Day would say, you can take your pick. You either go with God's way or you go with man's way. God's way is free, and it works a lot better than man's way. So anyways, I was just making the point that you got to be careful what you do. There's so much you can do for yourself. Sometimes you need help. You need the doctor's medicines. Yeah, fine. But don't just rush into it, because the doctor a lot of time will put you on a bunch of mitochondrial inhibitors, not on purpose. They just don't know what they're doing. They're ignoramuses. They don't know nutrition. They don't know epidemiology. They don't know toxicology. They don't really know the side effects of their own drugs. So anyways, be careful what you wish for, because make sure your doctor knows what they're doing before they put you on a bunch of mitochondrial inhibitors. Getting back to that slide. Let's just go back to that slide for a sec. Look at all the things that are mitochondrial inhibitors. There's a ton of common medicines that are mitochondrial inhibitors. By the way, I forgot to mention, if you're eating processed food, there's going to be antifungals in there. that are mitochondrial inhibitors, mold inhibitors. They put mold inhibitors in all the processed food and all the fast food, so it doesn't get mold on it and get sent back to the company. There's tons more of them that are real common. Tricyclic antidepressants, selective serotonin reuptake inhibitor antidepressants, antipsychotics. Okay, it goes on and on. Tylenol, tramadol, antibiotics, lots of antibiotics, tetracyclines, aminoglycosides, fluoroquinolones, penicillin beta-lactams. Anyways, you get the point. So it's good to live simple. Be like Adam and Eve, but keep your indoor heating and plumbing. Hope that was helpful.